Hi everybody, welcome to UroChannel. Erectile dysfunction is a condition that affects many men when they approach 50, and it gets even worse with time. If you are nice to your body, train regularly, eat healthy, keep your weight, and never smoke, you will increase your chances of being able to retain a lot of your erectile function into older age. But at some point, nature will kick in, and pretty much everybody who is fortunate enough to enjoy a long life will need some kind of medical treatment. In this video, I'm going to explain my treatment strategies for ED in the aging male. My name is Stefan Buntrock. I'm a urologist and sexologist. Erectile dysfunction has many causes, and some of them might not be that obvious. So everybody who walks into my office with ED gets a proper check. This is a thorough medical history, including regular medication, and a focused interview on how, where, and when erectile problems happen. Then there is a physical examination where I also check for high blood pressure, one of the main destroyers of erections, and most of the time I do an ultrasound of the penis to rule out any obvious pathology. Every once in a while I discover calcified plaques as a sign of Peyronie's disease, which would be the cause of the ED. Occasionally, I also do Doppler sonography together with an intracavernous injection to rule out any veno-occlusive problems or diminished arterial blood flow. Lab tests are very important too. I want to have a look at androgen parameters, but also other stuff that might have an impact, like blood sugar for diabetes and thyroid function. Erectile dysfunction might have psychological causes as well. But for the sake of the physical focus of this video, I'm going to skip that point for now. So when all the data is collected, it is time to think about treatment. If there is any medical condition to be treated, like diabetes or hypertension, it will have to be taken care of first. Then there is the existing medication. Is there anything with side effects like beta blockers that could be replaced? Here there has to be a talk among doctors, since I won't interfere with someone else's therapies. If everything is clear, a targeted therapeutic regimen for the erectile dysfunction will be started. I have outlined the fundamentals in this video. Every intervention works best if not counteracted by modifiable parameters. Physical exercise is the foundation, weight management, healthy eating habits, and very important, no smoking. PDE5 inhibitors are a good starting point to find out how much erectile potential there is left. The first PDE5 inhibitor on the market got to be known by the name of Viagra. There are many myths and false beliefs about these drugs. What they do is to inhibit a link in the chain that will normally cause erections to stop, which is a smart thing to happen if you think about it. Otherwise, you would get an erection once that will last for a lifetime if there wasn't some kind of mechanism to reverse that. PDE5 inhibitors are very effective, but you don't have to worry. They don't cause automatic erections. Usually, you will have to be sexually aroused for the medication to take effect. And they don't enhance sexual desire. There are short-acting substances on the market like sildenafil and vardenafil, and long-acting, tadalafil, avanafil, and in some countries, udenafil. Common side effects include headaches, flushes, and stuffy nose. Talk to your doctor if you want to know more about it. Low-intensity shockwave therapy, ESWT, may be an option for some patients. I uploaded a video about this method and will also put a link in the description. Especially in cases where PDE5 inhibitors cease to be effective, ESWT is able to reverse this process. Injection therapy has been around since the beginning of the 80s and is very effective too. Many men are afraid of needles, and the thought of injecting anything into their penis is frightening to them. But actually, when done the right way, the small pinch of the needle is hardly noticeable to most. It's also possible to avoid needles and apply the medication directly into the urethra, either by using a gel or a small pipette. These modes of application might not be that effective in some patients, so it's basically trial and error here. If it works, then the method is suitable for the individual patient. If you're not into pharmacological aids, there are the physical treatments. I already named low-intensity shockwave therapy, but the oldest method of them all is vacuum devices. The penis is put into a tube and air is sucked out of it. The resulting vacuum will bring about an erection. A constriction ring at the base of the penis will prevent the blood from leaving the organ. In some men, using a constriction ring on its own will also work. The disadvantages of vacuum devices include a time limit, as the ring will have to be removed after a while to prevent damage to the penis. You might know this from own experience when putting a rubber band on your finger. It doesn't take long before it starts to hurt and the finger turns purple. Another thing is erectile stability, which is an issue with vacuum pumps, because on the other side of the ring, the penis will not be firm and rigid. If nothing is effective, there are also surgical options. Penile implants are used to replace the cavernous bodies of the penis. There are several models, but usually an inflatable device is implanted. A small pump in the scrotum will fill the prosthesis with liquid from a reservoir that's put in place in the small pelvis. I think in other parts of the world, implants are more popular than at my place in Lower Saxony. So far, the number of patient requests has been next to 0. This was a short outline of the things that will work for most. Thanks for watching. Bye bye.